Good evening, friends. Today is International Yoga Day. There are a lot of talks going on yoga, and yes, yoga should be done by everybody. I too practice yoga, and I would suggest you to do that because there are multiple advantages to both the body and the mind alike. Now, being a cancer specialist and oncologist, I am often faced with certain questions like, is yoga fit for cancer patients, or does yoga help cancer patients, or can yoga be done by patients who are suffering from cancer? So this video is all about that, and let us see yoga in the perspective of science and evidence. And I hope by watching this video your concepts would be clear. If not, it would be better, and I hope you would watch the video till end, like, comment and subscribe. So let us begin. As all of you know, yoga is a form of exercise. However, among all exercises like walking, jogging, running, swimming, playing basketball or football or whatever it might be, yoga is the least painful of the exercises. It is, as all of you know, is a combination of breathing and meditation. It is the least stressful of the exercises, and in addition to that, it removes stress, it de-stresses you, whether you are a normal person, whether you are a person with stress, or whether you are a patient of cancer or a cancer survivor. So it is useful not only for cancer patients, it is also useful for their caregivers alike, and the benefits of yoga in almost everybody, including cancer patients, cannot be denied. Well, it is well known to you and many that yoga is a science, it is an art that perhaps began in India and in the adjacent areas of the world. It is practiced with glory all over the world, and it is one such entity which can be considered as an holistic approach to health, that it not only takes care of your body, it takes care of your mind, that is, it heals the body and the mind together, and this is the best benefit of yoga. So far we have talked about the usefulness of yoga, but now let us be little more cautious and let us see what the scientific community has to say and what evidence do we have to suggest that it is helpful to the cancer patients. Well, as far the evidence goes, we do not have any hardcore data yet to say that it is definitely beneficial for the patients, because the number of studies done so far is very little, and analysis or meta-analysis of the existing studies, which are actually small and contain small number of patients, are actually equivocal. That is, they neither cite any benefit nor they cite any disadvantage of doing yoga. Small studies conducted in different parts of the world, including India, suggest that cancer related fatigue, it is a known entity to the oncologist, and it is a symptom which is often faced by patients, specifically those who undergo chemotherapy, radiation therapy or surgery, or a combination of the three, leading to the entity known as cancer related fatigue, that is fatigue arising due to the cancer. Studies have shown that yoga definitely improves or decreases cancer related fatigue, and it improves the quality of life. Evidences are coming from different parts of the world, that is, yoga can now be considered or will definitely be considered as a supportive therapy to improve the well-being of the cancer patients because it decreases the stress levels, it decreases cancer related fatigue, it removes depression, elevates their mind and helps in total improvement of the patient as individual. To cite a few scientific studies, one study was done in the year 2003 and was presented in ASCO, an international agency which deals exclusively with cancer patients and regarded with respect by almost all oncologists all over the world. The study presented then consisted of 126 breast cancer patients who were supposed to undergo chemotherapy or hormone therapy and were given 3 months of yoga classes, and they were later evaluated and they showed that there was a 12% reduction in the fatigue level in comparison to those who did not have the fatigue. Similarly, a similar study done in USA by the prestigious MD Anderson Cancer Center arrived at the same conclusion that yoga reduces fatigue level and improves quality of life. American Cancer Society, another respectable organization, currently in their website also encourages people to do yoga. Now, since we have known that yoga is useful and almost all communities of the world, all respectable institutions are encouraging the use of yoga even in cancer patients, we would like to know a little bit more. Yoga, as you can see from the slides, there are 8 stages starting from yama, that is moral doctrines, niyamas or the principles, asanas, postures, pranayama, pratyahara or the introspection or deviation from the external stimulus, dharana or concentration, dhyana meditation, all these 7 steps ultimately leading to samadhi. I have pointed out the number 3 and the 4, the third and the fourth, that is the asanas and the pranayamas are actually known to us as yoga. So by yoga, when we say that I am doing yoga, we usually mean that we are doing asanas and pranayamas, but from more theoretical point of view and practical point of view, yoga consists of 8 stages. At the end, I would thank you to give patience to my slides and to give your precious time in watching this video. I hope you like it and share it. Thank you all.